Hi, we're Group 17. I'm Phyllis.
I'm Brandon.
I'm Jessica.
I'm Victoria.
And I'm Carlo.
And we are doing a program on parents for physically active children.
Our goal is to increase physical activity resources within the San Diego community for children within the grades of K through 5, and our purpose is to reduce the risk of cardiovascular disease and obesity and to increase longevity and the quality of life.
So the objectives for PPAC, we have 3 of them. Our first one is that during the first 6 months of the year, at least 95% of parents will be able to be aware of the community centers that surround their neighborhood. Our second objective is that by the end of the year, 85% of children enrolled in PPAC will be at a healthy BMI range. And our third objective is that by the end of 1 year, 90% of parents who have a child in a San Diego elementary school will be able to list at least 3 sources from PPAC.
The conceptual model that PPAC will be using is the social cognitive theory. The social cognitive theory focuses on behavioral factors, environmental factors, and personal factors that help affect an overall increase in physical activity. In behavioral factors, knowledge and skills necessary to perform a behavior, as well as the children's awareness of various physical activities and how to perform them, are important. In environmental factors, individuals are influenced by other individuals and groups. Children will participate in physical activities if the activities desired are available and nearby. Children part of an active community will be more enticed to participate. This encourages community bonding and the awareness of physical activity sources. In personal factors, we encompass the child's expectations, self-efficacy, and reinforcement. We instill expectation that involvement in PPAC will help that individual become physically active. The child needs to believe that he or she can perform and participate in PPAC. This also stimulates a response in ways that will make the child continuously participate. These 3 factors affect the overall increase in physical activity, which helps reduce the risk of chronic diseases, cardiovascular diseases, and obesity. This also promotes longevity and a good quality of life.
We will be measuring our outcomes through observation. We'll be observing different schools, one with a program and one without. We'll be also measuring these things through BMI. Also, we're going to be using the Activell, which is a type of 3D accelerometer, which will measure the physical activity of each child. And we're also going to be taking photos of each child before our program, in the middle of our program, and at the end of our program.
We will be having an experimental pre-test, post-test, where we will measure the children's body mass index, their physical activity through the use of an accelerometer, and we'll be taking a picture as reference. During the first observation, so 01, that's when we will measure their BMI, their physical activity, and that's when we'll first take a picture. So for X, that's the first intervention. That's when we tell the children how to improve their physical activity through the use of clubs, sports, and other activities. And then after our intervention, we'll have O2, where we will be observing their BMI and physical activity level again. Then we'll have another intervention, so another X, and then we will have our O3, the final observation, where we will finish by measuring their body mass index, their physical activity. We will take a picture again to see, to compare it to observation 1 and see how the program has affected the children.